Joining us in the studio is Dr. Mariam Ashuri, public health physician. Thank you for joining us at this time. We're seeing a lot of, talk about medical doctors, healthcare workers who are now, really exposed to the pandemic as frontline workers. First, I'd like to ask, how regular is testing for frontline workers?
Okay, well, first of all, frontline workers aren't only people concerned about managing, contact tracing, or case investigation of COVID-19 patients. Every healthcare worker at every health facility, health institution is a frontline worker. And it's very important that healthcare workers that notice that they have been exposed or they have had contact with individuals who have been positive or suspected cases should actually go for testing. At the moment in Lagos, there are over 20 sampling sites in each of the designated local government areas, which in their numbers that you could call, and then you get an appointment fixed, and then individuals are scheduled so that to avoid overcrowding and all that, and then you come for testing. Likewise, at NIMA, the Medical Research Center, you could go online, going through their website, www.nima.covid.com.ng, and then you could register online. You'll be given an appointment date, and then you could go for testing. It's also very important that because your tests, the test of your results starts from, your result is valid till the moment you were tested. You could test negative next moment, and next moment you would have gotten infected from.
So the thing is, because we don't have a lot of, healthcare workers, doctors, nurses to cater to the population that we have, should we make it compulsory that, doctors, health workers on the front line should have a regular testing, maybe once a week? Do you think that would help? So we don't get to see a lot more workers, in isolation?
Yes, in as much as it will help, it will still stop the fact that healthcare workers need to be protected. Because even if you get tested, you're still going to go back to work. You still need to attend to your patients. Every individual is a suspect, so you still need to get back to work, attend to these clients. And it's not making it compulsory. It should be highly encouraged that healthcare workers should, as much as possible, try to test as often as possible.
About life as we ease into, gradual ease of the lockdown from Monday. What would life be for Nigerians? What should they expect? And, it's also a precarious time, seeing as we're still, trying to prevent the further spread of the pandemic, even though we're seeing more cases each day.
Most Nigerians, or let me put it at Lagosians, they are really excited. They want to go out. It's been like being locked in for almost 4 weeks. But now we have to be very cautious because we keep getting increased number of positive cases, getting them to the health facilities, to isolation centers, and then we're still doing contact tracing, trying to line list those that they've had contact with, and also case investigation, sample collection, awaiting results, and now there will be so many people out on the street. Lagos State government had the press release yesterday, which is still in a bid to curtail the release of the lockdown. They've been trying to, at least part of things that the governor mentioned yesterday was that for health essential services will still be provided, but public service workers, grade 1 to 12 will still be at home, while grade 13 and above will still work. And even for commercial vehicles, for tricycles, they're supposed to have only 2 people in the vehicle, and then for the buses, it should not be more than 7. But now the question is, how well will people comply? It's supposed to be curfew from 8 p.m. to 6 a.m. Are people going to really adhere to all those strict measures? Yes, well, they also put in measures for whistleblowers. So people, when you notice your organization or some other individuals are not complying, you could call in to mention that, yes, these people need to be they need to be arrested or something. Right. But the enforcement needs to be real and people need to comply.
All right. We appreciate your time, Dr. Mariam Ashuri, public health physician. Thank you for joining us.
Thank you so much.